and all sectors, including both government and private sector, was copied from all over the world. So if you go to different countries now, you'll find commissions and they will tell you that we got this model from Uganda, of having an entity that is dedicated, but that, is there coordinating all the different sectors. The objectives of the commission is largely to ensure that, one, we develop policy and strategy to guide all interventions in the HIV response. Two, that we provide oversight and ensure that what we have written within the policy and the strategic plans is being implemented according to that what we have written down. So we do constant monitoring, we get quarterly reports, but also we coordinate the resource mobilization as Uganda AIDS Commission for the national HIV and AIDS response. What have we achieved over time? Uganda really for a long time has been a success story globally, like I have said. We've managed to reduce the HIV prevalence from 18%, an average of 18%, but in certain subpopulations, the HIV prevalence was as high as 50 or even 60%. If you went to populations that were at high risk, what they call most at-risk populations, the HIV prevalence was really, really high. So that has been reduced. As we speak now, the average HIV prevalence is 6%. It means 6 out of every 100 people when tested, they are HIV positive. Of course, in certain population groups and geographical locations, it is higher than others. If you go to the island areas, for instance, in the districts of Karangala or the Sesa Island, you'll find that generally the HIV prevalence is higher, and it's mainly because of the lifestyle. If you go to busy commercial centers, busy places where you have commercial sex work, you have long distance drivers, again, the HIV prevalence is much higher. While we have had regions that have continued to have fairly low HIV prevalence. If you look at the regions of Karamoja, until recently, Karamoja's HIV prevalence remained way, around 1%. Highest 2.5%. If you go to the regions of West Nile, again the HIV remains largely low. And the main reason is because of the cultural practices of these regions. They have very strict prescriptions around whom you have sex with and how that is done. Although, that is changing because of commercialization, because of, what is happening in those regions, immigration and so on. But there are regions of the country where prevalence remains low, and then there are those regions where HIV prevalence is high. Our government has worked with development partners, and we've had a very high enrollment on antiretroviral therapy. So we have an estimated 1.4 million people living with HIV. And out of those, about 1.2 million are enrolled on antiretroviral therapy. We have about 200,000 people who are out there. Some of them probably don't know that they have HIV, but others are still in the, trying to make a decision on how to start on treatment. So that remains out there. The other challenge is that up until now, our HIV response and health generally remains predominantly donor funded. Up to between 70 to 80% of the resources are provided from donors, and largely because our government has been doing prioritization. It can't fund all the things that it needs. Although in the last few years, government has significantly increased its contribution to HIV. For instance, currently, I think government is providing close to $50 million every year, contributing towards purchase of ARVs, but we still receive a lot of funding from donors, especially the American government, the government of Ireland, the Global Fund, the UN team, and other bilateral partners who support our HIV. So we are trying to move and say, government needs to increase its own contribution, and we've started on a drive called HIV mainstreaming, where every department, every sector makes HIV part of its agenda. It has a workplace policy. It makes a 0.1% budget contribution, and that way, even if the donors, changed priorities and shifted away, we would still be able to move without feeling a lot of shock from their withdrawal. More still, when we look back at some of the things that Uganda has been able to do, leadership really being in the lead, because many countries around the world were staying in denial. They did not want to admit that they had high prevalence of HIV within their countries, because they thought that if you admitted that there was HIV, then you would lose tourism, then people would move away and it would cost the country. Now, for us as Uganda, we had a leadership that, you know, came out very openly, while many countries were still in denial. The president, you know, instructed everyone. So that was very, very helpful in terms of leadership being at the forefront, and also leading to the establishment of the Uganda AIDS Commission, like I've said. One of the key mechanisms around the approach that have also helped us is something that is known as the partnership mechanism. Now, the partnership mechanism is an arrangement where, if you are a national organization, how do you reach all your stakeholders? So we decided to segment the way our stakeholders are arranged into similar groups. First of all, on the government side, we said we will approach Parliament as a group, because they are policy makers. We do advocacy with them. They allocate resources, and they continue to lead, you know, the prevention oversight. Ministries, departments, and agencies, we also put them in one group. We said this group needs to ensure that there is a workplace policy, that their staff, employees are protected, that also the communities they interact with are protected, that they have an HIV focal person in place, they have a committee, and they are allocating resources to that. We have private sector also as a group. We have media as a group. We have cultural institutions as a group. We have faith-based organizations as a group. We have, you know, the AIDS development partners. We have the decentralized response, because action and implementation takes place at districts. So what we do, all local governments have an HIV focal person. We have the district health offices. There are district AIDS coordination committees, and those are the ones that are supervising the HIV activities at that level. And they are multi-sectoral in nature also, because the district AIDS committee, chaired by the district LC5 chairman, and the CAO is the secretary, and having all heads of departments, people living with HIV, heads of religious institutions. So it's like a replica of what happens at the national level, and they are supposed to supervise HIV AIDS activities at that level, ensure that a district has an HIV strategic plan. So the partnership mechanism is really a flagship arrangement and programming on how we approach HIV. Then we have what we call the partnership committee, which is, or the committee of technical experts, which is the policy committee at this level that advises the board, and its representation is generated from different implementers of HIV and AIDS.
The Uganda Coffee Development Authority, UCDA, is mandated to oversee the coffee subsector.
Our office is in Musoba, and it houses the lab which analyzes all the export coffees before they are dispatched.
They do quality control management of coffee production, marketing in Uganda and on the international scene.
Buyers abroad, if they cannot taste the coffee, then often they may make a wrong decision when buying.
Before us here is a sample roaster, which we use for roasting the coffee samples for export.
So the exporter has to apply for inspection at UCDA offices. We have to check that the exporter is licensed, and they have to be licensed by UCDA before they can carry out any export.
Join us for the talks and trainings about coffee on Mondays on UBC TV.
Double data. Airtel introduces double data, the biggest deal ever on smartphones in Uganda. Buy a smartphone, 3G or 4G, and get 100% data bonus from Airtel. Airtel is giving you 100% bonus data on all weekly and monthly bundles for every new smartphone connected to Airtel for the first 3 months. Dial *175*9# to enjoy double data. Double data, double data. Oh, bino bye biruma. Yeah. Airtel, the smartphone network, regulated by Uganda Communications Commission.
The Electoral Commission informs stakeholders that the period for campaigns is as follows. Presidential and parliamentary elections, 9th November 2020 to 12th January 2021. City, district local government councils elections, Lord Mayor, mayors, chairpersons and councillors, 9th November 2020 to 18th January 2021. Municipality, city division chairpersons and councillors elections, 9th November 2020 to 23rd January 2021. Sub-county, town, municipal division chairpersons and councillors elections, 9th November 2020 to 1st February 2021. Campaigns will be conducted from 7 a.m. to 6 p.m. and candidates are reminded to stick to their campaign programs as submitted to the Commission. Voters are encouraged to listen to the candidates' manifestos in order to make informed decisions. While conducting campaign meetings, you should wear face masks, wash your hands and observe social distancing to limit the spread of COVID-19. This message is brought to you by the Electoral Commission.
As you know, we are going to be using these masks until COVID is gone. Before you put it on, make sure that your hands are clean. Wash your hands with soap and water. If you are in a place that you do not have soap and water, ensure that your hands are sanitized. You make sure that you cover the mouth and the nose. You make sure that the lips cover the ears. Make sure that it covers your cheek and it covers your upper part of the nose. If you want to adjust upward, you can adjust like this. When you want to remove, you hold this and you remove. Make sure that you wash this mask and hang it somewhere that is safe to dry and you iron it.
This message is brought to you by Ministry of Health, supported by Precision Media, UNICEF and World Health Organization.
One of the key groups that we've put emphasis and focus on are the young people. Because as we know, Uganda is a country of young people. Currently more than 70% of our population are youth and young people. And therefore, and yet for most of the young people, they were not here to see the HIV and AIDS of the 80s and 90s. The one where there was no treatment, the one where somebody lost weight, had diarrhea, had severe skin disease, had herpes, what was called GCP. Very deaf, you would look at someone and just know that this is HIV. They never saw that. So when you sound the drum, when you play the File Rutaya songs, it doesn't communicate anything to them. And therefore we are targeting the young people with very specific messages through fellow young people, through peers. I'm sure as Ugandans, if you've observed, we have a very vibrant group of young people who are born with HIV, who have formed themselves into a group and who have formed the beauty pageants at regional level. And the intention is to fight stigma, to sensitize other young people about the risks of how to prevent and how you can get infected with HIV, but also to show that even as an HIV positive young person, you can live positively, you can go through university, you can become a lawyer or a teacher and also protect yourself. The other group that we work with are the people living with HIV. There's a national forum of people living with HIV. It has a chairperson. It has branches in every district. And this has also been a very powerful platform. But now, during this time where people are on medication, when somebody moves around, they look normal, they look like you and me, it is becoming harder and harder to continue to take out the message. There is a lot of complacence. When we tell people that there is still HIV, that there is a risk, people say, no, we are tired of this message. But we tell them there's no cure. There's no cure. There's no vaccine. HIV is still here. And the medication that is available is only able to suppress the virus. The moment you stop taking the medication, then it goes back. So we've gone back to the drawing board and say, how can we package and take out the message? The institutions we are partnering with are the faith-based organizations, the religious leaders. Because the religious leaders have, first of all, a following in their places of worship. They have people they speak to every week. Through faith-based organizations, they reach up to 18 million followers. So we've partnered with them, and we have developed what is known as the pastoral letter. And the pastoral letter is really broken down messages of HIV prevention. The other group that we are partnering with are the cultural institutions, the cultural leaders, like the Kabaka of Uganda, His Majesty the King of Toro, the Bunyoro, all the cultural institutions in Uganda, because they are very powerful mechanisms through which messages are channeled to young people. They are listened to. People listen to them. They respect them. So that's how we've been pushing this. One of the areas where we've been most successful in fighting HIV is prevention of mother to child. A few years back, the First Lady, Her Excellency Janet Kataha Museveni, partnered with the Ministry of Health, UNAIDS and Uganda AIDS Commission, and went around the country preaching to ensure that every young woman goes to tests, especially those who are pregnant. They go on the medication and deliver in health facilities. As we speak now, Uganda is one of those countries where more than 95% of women who are HIV positive and become pregnant deliver babies who are HIV negative. So we've been very, very successful. We've been an example. There are still a few babies who are born of HIV positive mothers who still become positive, because a few mothers still deliver away from the health facilities or are rising out of stigma, and that they get affected. But largely, it's one of those areas, prevention of mother to child is one of the areas where we have been extremely successful. We've seen, more and more better drugs coming, because originally people would swallow many pills, what they call the pill burden. Somebody would have to swallow up to 20, pills a day, maybe taking them 3 or 4 times. So that alone, and they had many side effects. Now the science has become better. The medication are fewer. You can, as we speak now, there are combinations where you just swallow 1 pill per day, and it has very few side effects. And research is going on of injectable antiretrovirals. So we need to really continue with the message and keep alive. Now, this year was indeed very unique, because even as we struggle with HIV, there are other diseases. There are non-communicable diseases, which is now a new problem. This year COVID-19 came. It's a very highly infectious condition. For HIV, it takes quite some effort for you to get it. But for COVID, all you would need is to be in a close proximity with somebody who is infected, and then you will have it. And because as a country, the leadership wanted the population protected, rightfully so, COVID prevention measures were implemented. There was a lockdown, the public transport was closed, so that meant that people who are HIV positive and need to move to get their medication couldn't move. Many times, because of stigma and discrimination, people do not attend the health facilities next to them. They always move to facilities that far away, where they are not known, where health workers don't know them, and where individuals will not see them in the HIV clinic. Now, because of the lockdown, they couldn't move. And when you're on treatment, you're not supposed to stop, because when you stop, then the viral load will go up. And when the viral load goes up, you fall more sick. You are also more likely to transmit to your sexual partner. It has those disadvantages. But we had a way of going around that. First of all, once government realized that in itself was a problem, they put in place exemptions. They say that no, if you're HIV positive, if you're a pregnant mother, you will be exempted, and your transport will be allowed to move, or even free transport will be found for you to travel. The other challenge during the COVID period was food, because livelihood was affected, and when you're on ARVs, you're supposed to maintain your medication, so that could also have caused a disruption. The International World AIDS Day is a commemoration that was started way back and has been, commemorated for the last 30 years or so. And this is a worldwide event. It is basically to remember those who have been affected by HIV and impacted, and those who have succumbed. The theme for this year globally is Global Solidarity, Shared Responsibility. For us as Uganda, we customized that theme, and our theme for the World AIDS Day in Uganda is National Solidarity, Shared Responsibility to End AIDS by 2030. So we would like every individual of us to know, and it's not just the responsibility of government, it's not just the responsibility of the church, or it's not just the responsibility of our community leaders to fight this disease. It's each one of us. So we need to increase the effort. We need to, as media, you've done a great job. We would like to thank the media, and we hope you can keep taking this message to the population. So in conclusion, I would like to urge young people especially, because as a young person, if you're to realize your dream, you have to remain alive. And if you need to remain alive, you'll have to protect yourself. Make sure that you do an HIV test, and once you've tested, if you're HIV negative, keep yourself negative. If you're HIV positive, go to a health facility and you'll be guided on what to do. I would like to urge the religious institutions to continue spreading the message of HIV prevention and urging their followers to go out and utilize health services. I urge the cultural institutions to tell their followers so that they continue to utilize services within the health facilities. They go out for the testing and they make sure that they prevent themselves against getting HIV. I thank government. I thank especially Parliament. Parliament has been instrumental in terms of oversight and supervision. I thank you for allocating resources and drafting policy for the HIV response. I request that you allocate more money for HIV coordination, for HIV prevention, and also for HIV treatment. I'd like to thank the Minister in charge of the Presidency for the work that she has done for supervising Uganda AIDS Commission. I thank the board. And last but not least, I'd like to thank His Excellency the President for leading, unwaveringly, for always leading by example, for talking about HIV, and for taking the leadership and enabling us as a country to get to where we are. I thank you.